Man Cave Health fosters a supportive community dedicated to men's health and wellness. They have events, discover ways to give back, access vital resources for people as well, and find support for people who need it. And with me is Tom Milana, the founder of this. And let's just go back to the beginning. So you have a personal experience with prostate cancer.
I did, unfortunately. So I just had my 9-year anniversary of prostate cancer and being cancer-free. I was diagnosed at 48 years old. Simple blood tests, red flag went up, and 3 weeks later, I was diagnosed with prostate cancer.
Okay. So what do you do then? When you created Man Cave Health, what did you, having been through this experience, know that people need when they're going through this?
So going through the process, anyone that has cancer, it's not a fun process. And going through this journey, I felt like men were treated like second-class citizens. They put you in a room, you're packed in like a herd of cattle. And the original thesis around Man Cave Health was to build man caves in hospitals. I feel if men had a better experience when they went to the doctor, more men would go. 49% of men don't go for their annual physical every year. That's why 30,000 men die of prostate cancer every year. And I think by giving them a better, experience when they go, maybe more men would go for their annual physical. And that's kind of how Man Cave Health came alive.
Yeah, interesting. Yeah, it is kind of like, sterile and clinical. It's not a real warm experience.
Right. But when you go to a woman's facility, I have 5 daughters and a wife, and they go to the doctor, and it's a much different experience. They got these beautiful spa-like places to go to. And I just think the medical field has it a little backwards when it comes to men. And that's kind of how we came up with this idea.
So where are you with the Man Cave concept?
So we built our first man cave 5 years ago. It's in the Department of Urology at Mount Sinai.
Okay.
We proved out this concept. We donated a bunch of money to do that. Our second man cave opened up, I guess about 1.5 years ago in Newport Beach, California. We're not donating any more money to hospitals to build man caves. We've proved out the concept. So if a hospital wants a man cave, we will support it. We will get men to come. Our focus now is building mobile testing vans. So we're in the process of building out 3 Sprinter vans, 1 for New York and Long Island, 1 in Boston, and another one in Newport Beach, California. So the whole idea around that is if men don't want to go to the doctor, we'll take the doctor to them.
Or you just go to neighborhoods, sporting events?
We go to neighborhoods, sporting events. We rented a Baptist church in Harlem a few years back. We tested 300 African-American men. 44% of the men had elevated PSAs.
Wow.
It's a huge problem.
Okay.
Just recently, we tested over 200 men at the global Milken Conference. So Michael Milken has done more for prostate cancer than probably anybody in the world.
Prostate cancer.
He did.
Yeah.
And he formed the Prostate Cancer Foundation. This was the first time in the history of the Milken Conference where they actually did testing at the event. So we tested 200 men, and the ironic part was 60% of the men that got tested, it was their first time getting screened. And that's part of what goes to, 49% of men don't go for their physical.
Yeah.
These are affluent men.
Right.
That first time ever getting screened for prostate cancer, 60% hadn't gone through the process yet. So we found out pretty amazing statistics.
So you are making a difference in terms of health and just awareness of prostate cancer?
I believe we truly are. Early detection is the key, not only for prostate cancer, but for any type of cancer. And again, if men don't want to go to the doctor, we have another solution. We'll go to them. We do car shows. We did a lacrosse game out in Long Island 2 months ago with Hofstra University. We did NASCAR last year. We tested over 400 men at Pocono Raceway last year. 2 years ago, we actually did a testing event at the Rose Bowl, Alabama, Michigan, in the parking lot of the Rose Bowl. So we have big plans for, 2025 and beyond. And so that's kind of what we do and what we're going to, moving forward.
Now, where do you see this in 5 years? Where would you like to take it?
So my goal is, and my executive director will kill me for saying this, I want to build 25 vans in the next 3 to 4 years. That's what our focus is.
Okay, and it'll be in different cities,
It'll
or
be in different cities. So right now it'll be New York, Boston, and Newport Beach to start. We're already talking to medical people in LA, in Miami, in Gainesville, Florida. People are finding us now. We've gotten a lot of traction in the past, 6 months. Our alignment with Prostate Cancer Foundation has definitely helped, in our association, with them. The new president of the foundation, her name is Gina Carruthers. She's an amazing person. We met about a year ago, and we're doing every event we do now is a joint event, which is kind of cool. We have the largest organization in prostate cancer wanting to work with us.
How can somebody find out more about what you're doing or where one of these vans will be?
So our website is mancavehealth.org. We have various events throughout the year. Our golf outing is coming up on June 9th. It's our largest fundraiser of the year. For men that have prostate cancer issues, there's an 800 number on the website. It's a hotline. You're looking at the hotline right here. I talk right now to probably 15 to 20 men a month that I have no idea who they are. I never met them.
They've been diagnosed? Or?
They've been diagnosed, early diagnosis. Part of the problem is when you get cancer is you go to the internet. And there's nothing good on the internet, no matter what kind of cancer you have. And to be able to talk to somebody that has gone through the experience, it's refreshing. It's probably a bad word to use. And the best thing to come reassuring.
Yeah.
But the best thing to come out of COVID for us was virtual support groups. We used to have a support group once a month, and we get 4 or 5 guys show up. We've been doing virtual support groups twice a month since the pandemic. We get anywhere from 20 to 500 men show up.
Wow.
Every other Wednesday. And to be able to sit, you can turn your camera off, you can be anonymous, which is what I think a lot of men like about it. A lot of men don't like to talk about their health issues, especially when it has to do with their prostate. And to be able to just listen to 20 other men or 30 other men that are either going through what you're going through, have gone through it, it's reassuring.
Yeah.
And it's what men need.
I'd imagine so. Well, it's great what you're doing.
Thank you.
Thank you so much. And you're making a difference, Tom. So thanks for coming and sharing with us.
Thanks for having me.
Yeah.
Appreciate it.